Radio Doctor is Nigeria's first specialized health program where doctors consult for free and advise you on women radio. The program airs from 10 a.m. Monday through Friday. Today, we are delighted to have Dr. Ogunko Moromoke Tawa, a general practitioner, joining us to discuss a very important topic: general overview of sickle cell anemia and tips on effective management during this long school break. Sickle cell anemia is one of the most common inherited blood disorders in Nigeria, affecting thousands of children and adults. School holidays can be exciting for children, but changes in routine, increased outdoor activities, travel, and weather conditions can also increase the risk of sickle cell crisis if proper care is not taken. Today, we will explain what sickle cell anemia is, address common misconceptions, discuss how families can manage the condition effectively during the long school break, and share practical tips to help children stay healthy and enjoy their holidays safely. My name is Atula Hassan. Today's program is powered by Teledoc, a secure digital platform that allows you to consult verified doctors anytime, anywhere. Doctor, thank you for joining us and you're welcome to Radio Doctor.
Thank you very much. Thank you for having me.
Okay, the phone lines will be open shortly for you to ask your question. But before then, the time is 7 minutes past 10. This is Radio Doctor on Women Radio WFM 91.7. The doctor's contacts will be shared at the end of the program. Okay, so doctor, what is sickle cell anemia?
Thank you. Sickle cell anemia
Hi, doctor.
is
Your voice is sounding far. We can't hear you well.
okay. How is it now?
Still the same.
Still far?
Yes.
Is it better now?
No. I guess it might be because of the ports you're connected to.
Okay. Okay. Can you hear me now?
Yes, I can.
Okay. Okay. So I guess everyone can hear me now.
Everyone should be able to hear you now.
All right. Thank you very much. Sickle cell anemia is an inherited disorder that makes the blood cells, the red blood cells, to take an abnormal shape. The normal shape of red blood cells is supposed to be oval, something that looks roundish. But in sickle cell anemia, these blood cells take another shape. That is why it's called sickle. It takes a sickled shape, like the shape of a banana.
Oh, I'm hearing that for the first time.
Oh, so I'll try as much as possible to make things as simple as possible so that people will understand what we mean by sickle cell anemia. Now, this sickle cell anemia is actually um is like one of like the most common part of there's a particular like a blanket of sickle cell diseases, but sickle cell anemia is one of the serious ones that I would say that we see in this part of the world that is common to us, especially we Black Africans, and then also in sub-Saharan Africa. So, like I was saying, it makes the red blood cells to take the shape of like a banana. Now, the normal red cells, they are um you know how gel is when we eat, yeah, like chewing gum. They are
Yes.
malleable. They are able to move through the blood vessels. As the blood is flowing, the red cells are able to move. But these particular cells, because they are abnormal in shape, they are not malleable. They are not soft. They are sickled, like banana shaped. They are also hard. So because of that, when the blood is moving through the blood vessels, these blood cells, they block the tiny blood vessels. And you know that what red blood cells do is to carry oxygen, nutrients, and the rest of it to all the body parts. So you
Oh,
can imagine the normal red cells that will carry oxygen, nutrients, and every other thing. Now, these sickled cells that are banana shaped, that are not soft, that are harder than the normal cells. So they will not be able to move like the other ones. And then because they are not able to move through the small blood vessels, capillaries and all, blood vessels, the parts of the body where these oxygen nutrients are supposed to get to, the those parts of the body are not getting those oxygen, they're not getting the nutrients. So because of that, these parts of the bodies lack oxygen, lack nutrients. This is what causes pain, which is the hallmark of sickle cell anemia. Now, I would be using some words interchangeably: sickle cell anemia, HBSS, warriors, so to say. So, for patients that have this inherited blood disorder, we call them, they can say, oh, they are HBSS patient because their genotype will come out as SS. It
what
can
does
also,
SS mean?
okay, um, when we run, there are different types of genotypes.
Mm-hmm.
So there are, I don't know how to put it now, but I'm trying as much as possible to use less of medical terms. So now our genotypes, everybody know that the normal genotype, oh, the best one is AA.
Mm-hmm. People
All
like,
right. So, oh, people like you. You're so lucky. You're so lucky. So we have AA,
mm-hmm.
then we have the sickle cell traits, and we have the sickle cell anemia.
Mm.
Now,
Anemia
for
or
some, there are traits. There's sickle cell traits, there's sickle cell anemia. I'm going to break it down.
what of sickle
Under
cell?
the Thank you. Under the genotypes, you have the AA. So for someone that the genotype is AS, that person has the traits.
Okay.
So that person is carrying only one gene of the sickled hemoglobin. You understand it now? So we
Yes.
call it a trait. Do you understand? So for
Yes.
someone whose genotype is SS, that is the sickle cell anemia. Those are
Mm.
the ones that we say, oh, their genotype is SS, HBSS. This is the person that is a sickle cell anemic patient. Another person that I would also call a sickle cell anemic patient is whose genotype is SC.
Okay.
So we have AA, AS, SS, SC, AC, CC.
Well,
Yes,
what's sick,
yes.
doctor? It's like I
So
said.
so anything other than A,
Mm-hmm.
anything other than A is a trait.
Okay.
Yes, anything other than A. So when you have a C hemoglobin, you have an S hemoglobin, they are sickle cell.
Oh.
So you can have somebody, for example, now you can have somebody, that's why genetic counseling is very, very important before people get married. So if you have someone whose genotype is AA, marries anybody who is either who has the sickle cell traits or is sickle cell anemic, they would definitely have children that might also have the traits or become sickle cell anemic. Do you understand what I'm saying now? So for
Yes.
example, my genotype is AS, but I
Mm.
have siblings that have genotype SC.
Mm.
And I also have a sibling that has genotype AA. So how come? Because one of my parents is AC and the other one is AS.
Hmm.
Do you understand it now? So
Yes.
for the general public, what everybody knows is the AA, SS, AS. Even the SC is not as a lot of people don't even know that there is SC. A lot of people think they are SS and they are SC. Some people tell you that no, I've been doing my genotype and it's AS. So there are some investigations that we do actually that is actually like far above the routine genotype that we do, which is the HB fraction, like hemoglobin electrophoresis, that make us to understand, like really, really know, break this hemoglobin down, and we are sure that, oh, this person is actually AA, or this person is AS, or this person is SS, or this person is SC. So for the topic of discussion today, we're going to be talking about the sickle cell anemia. So it covers the SS and the SC. Do you get it now?
What about CC?
Now, CC is not a sickle cell anemia
Okay.
because they do not the from the we're going to go into some genetics now,
Mhm.
because okay, the issue is during coding, when these hemoglobin are being formed, when a baby is being formed inside, when the baby is being formed, or when the cells are being formed in utero. Now, when this hemoglobin is being coded for, all the cells in our body are made up of proteins. So
Mhm.
on the particular point, there are some amino acids. The glutamic, where there should be glutamic acid, that glutamic acid is replaced by either valine or lysine. So if it's replaced by valine, the person comes up with S. Replaced by lysine, the person comes up with C. Do you understand? It's just
Mm.
like you are beading, like someone that is making a bead. You are making a bead. So you use pink bead, white bead, pink bead, white bead, pink bead, white bead. And then after a while, instead of putting pink, white, you now put purple. Where you're supposed to put white, you now put purple. After a while, where you're supposed to put white, you now put purple. Do you understand it now?
Yes.
I don't know if I'm trying to make it as simple as I can. So that is where everything starts from. It's from where the hemoglobin, the protein, the coding for the hemoglobin, that is why it is an inherited disorder.
Mm.
That's why I said it is an inherited disorder. So when someone inherits two of it, you inherit one S from a parent, inherit an S from another parent. That patient comes down and their genotype becomes SS. So that person is a sickle cell anemic patient. So if somebody inherits one S and inherits an A, that person is not just a carrier. So that's a trait.
Hmm. Okay, so doctor, my next question. Most times, because I've known some SS patients will be talking, and next thing, my head, my leg, they start convulsing or they faint, and I'm usually scared. What happened? We were just gisting. What usually triggers a sickle cell crisis?
Thank you. A sickle cell crisis, just like the pathophysiology of it, is still the same. The what I explained initially about
Physio-
the yes, about the shape of the cell, the red cell. Now let's go back to that same point. For a normal red cell, the normal red cell is round in shape and the size, so it carries more oxygen, it carries more nutrients, and it takes about 120 days before the normal red cell will expire in the
Mm,
body. Now for the sickled one, because of the sickled shape, it is smaller in shape, it doesn't carry enough oxygen, doesn't carry enough nutrients, and then it takes about 30 to 60 days. It breaks faster. There's
mm.
something we call there's hyperpolymerization. I don't want to use too much of big English.
That's why I told you said pathophysiology.
Okay, let me say, okay, what causes the crisis is actually because these cells that are sickled, they have this tendency to break. They break faster. They don't last long like the normal red cells. The normal red cell would live for about 120 days before it will expire in the body. But these sickled cells, they don't live long. They take about 30 to 60 days. And then because of the properties that they also have that makes them to break faster. So imagine someone that has a lot of these sickled red cells. So they don't have enough oxygen, they don't have enough nutrients going into their blood, their cells, their organs, their tissues. So that is actually what causes this pain. You might be talking to them right now and the next thing they start having pain. And then I need to say this, if you look at them very well, you will notice that most of the time they are small for age.
Mm.
They are not as, like, if you see someone that is 13-year old and a sickle cell patient that is 13-year old, he or she will be smaller in body size than the other person that is not a sickle cell anemic patient. It still boils down to this same pathophysiology of the organs and tissues not getting enough oxygen and nutrients that would encourage the normal cell growth that they should have. Then another thing you would also notice in them is their eyes are usually yellowish.
Hmm.
Now, because of this constant breakage of these sickled cells, when red cell breaks, there are two products, iron and bilirubin. Now, the iron is stored in the body. That bilirubin is what deposits in their eyes that makes their eyes to be yellow. Because of this constant breakage. Now, this constant breakage is ongoing. It is ongoing. You understand? So now there's something we call hyperhemolysis. That is when the breakage is now going on at a faster rate than normal. That is when they now come down with crisis. But ab initio, at resting point, there is breakage going on because of the way their red cell is configured. Do you understand it now? So when they now have this crisis, this is what precipitates the pain that they have. Joint pain, bone pains, this one, their eyes are yellow. We're also going to talk about the things that predisposes them to having this crisis. Aside the qualities, or let me say the characteristics of these sickled cells, there are things that also tilts them, things that makes these red cells to break faster, things that make these red cells to block those places. And one of it is dehydration. Like I said, the cells are sickled, they are hard. So imagine when they are dehydrated, their blood is now thicker. The blood is not flowing freely like it's supposed to flow. So because of that, it will predispose to more breakage. So dehydration would predispose them to having crisis. Another thing that will predispose them to having crisis is malaria.
Hmm.
The way malaria will predispose them is because when we have malaria infection, that's malaria parasite. It reproduces inside the red cells. So imagine a red cell that is not of good quality ab initio for someone that is not a sickle cell patient that has malaria. Now look at the other person that has sickle cells. The malaria is also still the malaria parasite is now reproducing inside those sickled cell again. So you can imagine what happens. So malaria also tilts them to having crisis. Sepsis infection also predisposes them to having this crisis. So you can see that I said everything is like, it's like 1 plus 1 equals to 2.
Yes.
So it boils down to the characteristics of these cells and these things which predisposes these cells to breakage, reducing the supply of oxygen, nutrients to all these body parts, which will now lead to crisis in them.
Hmm. All right, the phone lines are now open. You can call us on 07000 or 08155 You can send your text message, your WhatsApp message, or your voice note to 07031 756 537, 07031 756 537, or 08155 917 08155 917 Today on Radio Doctor, we are discussing general overview of sickle cell anemia and tips on effective management during this long school break. If you have questions about sickle cell disease, pain crisis, hydration, medications, nutrition, traveling with a child who has sickle cell disease, or holiday care, now is the time to call and speak with our guest doctor. We have Dr. Mo. Doctor, please pronounce your name.
Moromoke Ogunko.
Okay, thank you, Doctor. Anyway, Doctor, what daily routine should parents maintain during the school holidays to keep children with sickle cell disease healthy?
Thank you very much. Um, for our warriors, we call them warriors.
Mm-hmm.
So for our warriors, for those that are attending sickle cell clinics, some are attending, some are not. But I want to speak generally. I want to say, okay, for anyone that has a warrior, in during these holidays, you want to make sure that they are well hydrated. You want to make sure that they are taking their routine medications, because there are some medications that they take every single day that
Mm.
helps to prevent sickling and also helps to allow the rate at which their blood cells are formed. So there are routine medications that I wouldn't want to say on air so that people don't do self-medication.
Mm.
Yes, I wouldn't want to say them on air, but there are routine medications that they take. You make sure they are taking their routine medications, make sure that they are well hydrated. For example, whenever it's a sunny day, for you and I, we say, okay, on a sunny day, we should take nothing less than 3 liters of fluids, aside other things that we eat. But for them, they have to take more than that. So hydration, 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 hydration. And then prevent anything that would cause what I described earlier. Prevent them from mosquito bites.
Mm-hmm.
Use insecticide treated mosquito nets. Make sure that you sanitize your environment. No water puddle. We just had series of rainfall. So
Yes.
depending on the area where you're living, if you're living in an area where you have water puddles here and there, there can be mosquito breeding here and there, you make sure that you prevent all this. Make sure that you use insecticide treated mosquito nets for them, prevent them from having malaria. Then let them have adequate nutrition, good nutrition. Some people come to the clinic and they say, doctor, someone said that my child cannot eat this, my
Mm.
child cannot eat that. And I tell them, I'm like, anything that is nutritious, they must eat. The only thing that a sickle cell anemic patient shouldn't go near is iron, blood tonic. Blood tonic that contains iron, blood tonic. In our environment, blood tonic is a blanket thing. They say, oh, we are taking blood tonic. That is the only thing that they cannot take. Anything that has iron. But any food, nutritious food, let them take greens, veggies. You don't have to be rich to take care of, to maintain good health for a warrior. You don't have to be rich. If they are going to eat rice, let there be proteins. Let them have good proteins. Eggs, egg is very good. Fish is very good. Beef is good. Chicken is good. If they are going to take swallow amala, let them take ewedu. Let them eat green leafies. Let them take fruits and vegetables. Hydration. If they have any wound at all, let's say they are playing, they sustain any wound, they are not candidates for, oh, they have maybe a burns injury. Let's pour this one, let's pour NG oil, let's pour anything that will cause sepsis, that will cause infection in them. You always avoid it. And if they have infection or they have any wound on their body, please let them present appropriately to health centers, to hospitals, where doctors that are well trained, people that know how to take care of them, will take care of them adequately. And when they have crisis, a lot of times when they have crisis, the crisis does not come suddenly. It comes like they begin to have a feeling, they start complaining little by little. Oh, mommy, I'm having headache. Oh, mommy, I'm tired a bit. Oh, mommy, this hand is paining me. Once they start complaining, paracetamol, let them take their routine drugs, take paracetamol, take a lot of fluids, let them rest, let them sleep. But after you've done that and then these symptoms are not abating, please let them present appropriately to the hospital where they are well taken care of.
All right. So, every warrior out there and to their families, we see you. Though we can't feel your pain, we know you're going through pain. Lots of love and light to all of you. Anyway, doctor, can children with sickle cell disease participate in sports and outdoor activities during the holidays?
Absolutely.
Okay.
Absolutely. Um, let me give you an example. We have a lot of sickle cell anemic people in the entertainment industry.
Hmm.
Yeah, there is one I don't want to mention, a household name. Mm-hmm. Do you know how many hours he spends in the studio? And
Hmm.
he goes for concerts. He travels all over the world. We have some of them that are footballers, professional footballers. Some of them are dancers. So they can be anything they want to be. A warrior can be anything he or she wants to be. The only thing is they should know their limits.
Hmm.
They should know their limits.
Good.
That is the word. The parents of a warrior, the family member of a warrior, the spouse of a warrior, the friend of a warrior, because their management is beyond doctor patient. It is the whole society. Warriors have clubs. We have sickle cell clubs. We have NGOs, foundations that take care of them. So if there is any warrior or anyone that has a family member that is a warrior that is not attending a clinic or that is not, affiliated to any maybe NGO or a particular club or supports wherever, after this transmission, we can always talk about it. Um, would send them to appropriate places where they can get support, because it's beyond the medications. They
Yes.
also need psychological support. They need emotional support. Their caregivers also need both psychological and emotional support, because it is expensive. I would not lie to you. Having
Hmm.
to have to procure medication daily for life. I'm not saying that, yeah, I have to come in here that being a warrior does not mean that you have to be a warrior for life.
Hmm.
Yes, you can do, if you want to do bone marrow transplants, It is available in Nigeria right now, where
Okay.
you do a bone marrow transplant and then you stop having all these symptoms of I'm having body pain here today, that one and all that. However, I need to say here, if you do a bone marrow transplant and then of course you do your genotype, it doesn't show that you are SS anymore. It does not change your genetics. Does not mean that that person would now marry someone that has the traits. Do you understand what I'm saying now?
Yes.
You can do a bone marrow transplant. That's the definitive treatment or management for sickle cell anemia. You do a bone marrow transplant and then you are free of all this pain, of all the sickle cells and all that. But your genetics is still there. That person still has to make sure that he or she marries someone who does not have the traits, so that they do not continue to have children that would have sickle cell anemia or carry the traits. But the question that he asked me, that can they participate in sports? They can absolutely participate in sports, but they should know their limits. They should be well hydrated. They should take their routine medications. They should avoid injuries.
Okay. What should parents include in a basic care? What should parents include in a basic sickle cell care kit during outings or travel?
When they are traveling, like I said, their routine medications,
Mm-hmm.
please have it in excess. Have it in excess, because you might plan that, oh, we are traveling for 2 weeks, we'll be back in 2 weeks, and you have a supply of 3 weeks, and you end up spending a month, and probably where you're going to, you cannot find the medications where you're going. So it is always good to have these routine medications in excess at home, and then when you're traveling, make sure that you take it in excess. Hydration, 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 hydration. Have a lot of water, depending on, I don't know where you're traveling to. If you're traveling by road, you're traveling by air, you're traveling on the water, you're going to the village, they're going to visit their cousins, they are going for summer break. Wherever it is they are going, you have to make sure that you plan ahead for them. You make sure that you, in fact, you let their caregiver know that they want to travel, so that you can have a basic plan for them. The caregiver is going to ask you some questions. Where are they going? How long will they stay there? Which area are they going? So we are able to like plan ahead with you. Okay, get this along, get this along, get this along. And if they are going to be staying with somebody that is not the primary caregiver, you have to let that person know that, oh, this person has this person is a warrior. Please make sure that this and this and this, make sure he or she takes her medications every day, make sure he or she takes this amount of water, make sure he or she takes this. So these are the things that we discuss when they come to clinic. So when they want to travel, like during this break now, they are going for summer break, they are going to grandma's place, they are going to their cousins' places. We discuss all this before they go. Make sure that they have all their drugs in excess. Make sure you let grandma know that they have to take a lot of water. Let the house help know that they have to take a lot of water when they take, when they leave home, when they leave the home, when they leave their parents, especially when they go to grandma's places, go to cousins' places, the tendency that they will not take their medication is there. The
Yes.
tendency that they will not take enough water is there. So when you alert those people and let those people know that if they don't take this is the implication. Oh, if they don't do this is the implication. Those people also have to understand why they need to take those drugs and why they need to drink the water, why they need to be well hydrated, why those things have to be done. Because if they don't know the reason why, they will not be able to enforce and encourage them to do it. My dear, it is not easy to drink water. I will not lie to you. Tell me to drink 1 liter of water in the next 1 hour, it is not easy to drink water. Just say, okay, be drinking water. It is not easy. So we give them incentives to, drinking water and fluids. They can spice up their fluids, their water, put flavours, tangerine, put vitamin C tablets, put things that will flavour the water for them, drop of ribena inside it, something that will, give them incentive to take those, fluids. So when we're even calculating their fluids, not only water, they take tea, it's still fluids. They take ogi pap, it's still fluids. But we still emphasize on this water, because in as much as they are taking their routine medication, we always tell them that water is also part of their drugs. So even if you are taking your drugs and you are not taking water, it's as good as you not taking drug, because it is the water that will help you to push all these things, push your blood cells, push the drug in your system and everything. So water is as important as anything. There are routine medications and hydration.
All right. So, doctor, what are the most important holiday safety tips you like parents and caregivers to remember?
Thank you very much. In these holidays, a lot of them tend to, want to go and play. A lot of warrior caregivers are overprotective, and I will not blame them, because it's not easy caring for a warrior. We want them to have, let them have their, let them be a child.
Hmm.
Other children are doing. However, with caution. Can you hear me?
Yes, I can hear you.
Yes. So allow them to play, allow them to do what other children are doing. So the tips I'm going to give the caregivers is: one, just make sure that they do all these their activities under supervision. Let there be an adult around. Let them not stray too far away from the house where you don't know where they are. Let them be let them also be responsible for themselves. Let them understand what they have. That is the reason why when we talk to them, when we see them in clinic, we don't talk to them like they are children, like they don't know. We explain what is going on with them. I have a 13-year-old that would tell me his routine medication, tell me his stable state PCV, tell me every single thing he's taking. So we make them to understand. When they understand what is going on with them, they understand their condition, they are able to also, they are responsible for themselves. And these warriors are, most of the time, they are absolutely intelligent set of people.
Hmm.
They are intelligent set of people. I've had warrior caregivers that, you know tell us, oh doctor, my child gained admission, I don't want her or him to leave Lagos, I don't want him to go far, I don't want him. You see, let them be who they want to be. We're not saying allow them to just stray away, but once they are able to take responsibilities for themselves over time, allow them be who they want to be. The tips is, once they understand what they have, they understand and they are taking responsibilities, please, that leash that you have on them, release it a bit, so that they grow confidence in themselves, that they are able to take care of themselves, and they are not feeling less of themselves. Some parents go to school and go and tell the principal or classmates that their children are warriors. So the classmates will now be telling them, Don't come inside the sun. Don't come and play ball. Don't come and do this. Any little thing, they don't want them to do it. It reduces their self-confidence. We're not saying you should not allow the school authorities to know. Of course, it is our responsibility as their caregivers, as parents, to let their school authorities know that, oh, this is the health of this child. This is the state of the health of this child. However, does not mean that this child cannot participate in things, but they have to be under supervision.
All right.
Okay. I can hear. I'm on my
Can
network.
you hear me now?
Okay, I can hear you now.
Okay. I said, finally, what message of encouragement would you like to leave with individuals and families living with sickle cell disease?
We see you,
Hmm.
we understand you, we feel you, and we love you. And you can be absolutely whatever you can be in life. The fact that you are a sickle cell anemic patient doesn't make you less of who God has created you to be. As caregivers on our part, we are here to do the best we can for you. You're warriors. We call you warriors because every single day you're fighting to survive. And because you're warriors, we have a lot of warriors doing great things. A lot of warriors doing great things. And I want to tell you that you're great. You're who God has created you to be. God doesn't dislike you. It is not your fault. It is not your mistake. It is not, you didn't offend God. Because someone has asked me before, I said, Doctor, did I offend God? Why me and not my sister?
Hmm.
And I said, you did not offend God. One thing I want to leave with you is the Bible says all things work together for the good of them that love God and are called according to his purpose. So there is nothing that happens to us as children of God that God does not know about, okay? So have it in your mind that God loves you and there is a reason why it is you. And it does not mean that because it is you, you will not be who God wants you to be. We love you.
Hmm.
We see you. We feel you.
Thank you very much, Doctor. Thank you very much, Dr. Ogunko Mora Moke, for sharing your knowledge and helping us better understand sickle cell anemia and how families can manage the condition safely during the long school break. To our listeners, remember that with proper medical care, good hydration, balanced nutrition, adherence to prescribed medications, and regular follow up with healthcare providers, people living with sickle cell disease can lead healthy and productive lives. Early intervention during any signs of illness or crisis can make a significant difference. If you'd like to speak privately with a doctor, download the TeleDoc app today. Book a quick 10-minute consultation or a full 30-minute session. Choose your preferred time, upload your medical records, speak securely through video consultation, and receive prescriptions digitally. Doctor, if we have any warrior listening today, how can the person reach you?
Well, any warrior listening to me today, I work with the Lagos State Government, Ifako General Hospital. That is where I work. So any warrior listening that wants to reach out, you can always come around to Ifako General Hospital. That is where I work in massology department. That is where we see warriors. You can always reach out to me. You can also reach out to me on TeleDoc app.
Mm.
I'm also on Teledoc app.
All right. Thank you for listening today. To the warriors, like your doctor said, we see you. I can't actually say I feel your pain because I don't know how it is, but I know your pain and we love you. Lots of light and loves. Thank you for listening to Radio Doctor on Women Radio WFM 91.7. My name is Hassan Matila. Do have a healthy day. Good morning.